Collecting sterile specimen from infant or young child.
So, hi, good afternoon. I'm JV Bervano and I will be doing the routine demonstration of collecting urine specimen from infant or a young child. So, what is the first thing that you need to do or the steps which you need to assess the working area if it is ready? So, it is in order to determine what preparation needs to be done in order to ensure a successful procedure. So, of course, you need to position the patient genitalia are exposed by placing on back with legs, which a frog-like position. So, assistants maybe need to hold the leg of the young child in proper position. So, it is in this kind of way, proper positioning will facilitate cleansing and allow a proper placement of collecting device. So, proceeding to the planning, you need to prepare all the materials that needs for the procedure or the supplies that needed for the procedure. So, the first thing that you need is collecting device, plastic, disposable urine bag or collector, urine bag or urine collector. So, of course, the cleansing agent, the cotton balls, the clean or sterile water, of course, the gloves, and then the specimen container and the container for solution. So, in this kind of way, organized materials facilitate easy access during the procedure. So, in the implementation phase, the first thing that you will need to do, of course, you need to identify the patient and explain the procedure to the guardian. So, I will explain it in Tagalog. It is because kaya natin kailangan i-explain ang procedure or ang gagawin natin sa ating pasyente or ating kliyente. Ito ay para maging aware yung mga guardian or yung nanay, tatay ng isang bata sa gagawin natin kasi sabihin, delikado daw, kailangan nilang malaman. So, in order to gain the trust, and to alleviate the anxiety of the patient or the guardian or even the baby, we tend to explain it or elaborate it sa mga guardian para maging aware sila at hindi sila magalit sa atin or para hindi sila magtaka kung bakit ganun yung ginawa. So, and then after that, you need to provide the privacy, closing the window and the doors. It is in order to protect the client's dignity. So, of course, wash your hands in order to reduce the transmission of microorganism. So, that is the first thing that you need or always remember that, which is wash your hands before and after the procedure. So, and then after that, you need to wear your gloves. It is because it is a universal precaution. So, after that, you need to proceed to the procedure and do it gently to the patient or to the client. The first thing that you need to do in this kind of procedure, of course, you need to wash your hands in order to reduce the transmissions of microorganism. So, I will be back and I will perform the hand washing. Going back, after that, you need to wear your gloves. So, I need to wear my gloves. Out of this table, these are the allotted or the materials that needed for the procedure.
So after I put my gloves, I have here the equipment that needed for the procedure. The cotton balls, the rain bag collector for the infant, and then the specimen container, trash bag, and then alcohol if needed. So the first thing that I will need to do, of course, is to explain the procedure that is needed for the client. So, ma'am, tatanggalin ko lang po ang kanyang kumot para po may ayos natin ang pagsagawa ng procedure.
So, of course, you need to remove the diaper first or untie the diaper in order to cleanse the genital area of the patient. So, I have a female patient. Cleansing the genital area for female using cotton balls dipped into cleaning agent or the cleansing agent. So, you need to wipe the labia majora from top to bottom or for the clitoris to the anus. So, only once with each cotton balls. After you wipe again with clean water, then you need to spread the labia apart with one hand while wiping the labia minora in the same manner with the other hand. So, you need to wipe the area dry. Okay? So,
I have it here. I will dip into the cleansing agent and then spread the labia. So from the top to bottom, which is clitoris to anus. Okay, one stroke each, then dispose, and then spread it again, and then dispose. So after that, you need to wipe again, of course, in the clean water. So I have here the clean water, and then dispose, clean water, clitoris to anus, and then dispose. So after that, in the labia majora, you need to do it in the labia minora. So I will do it again from the up or from the top to the bottom. Okay. So after that, I need to wipe the area dry. Okay. Then dispose. So it is necessary to clean the genital area of the client. It is because this method of cleansing the female will prevent contamination of the genitalia from the anus and it will also prevent the contamination of the urine specimen obtained. So during the cleansing, be gentle and you need to avoid any injury or possible stimulation of urination. So after cleaning the genital area of the client, the second thing you need to do, of course, is open the collecting urine bag for the infant. Okay, so I will throw it into the trash can, which is the... Okay, so I have it here and then place it to the genital area of the patient. So you need to apply the collecting bag firmly so the opening is exposed to receive the urine. Okay? So why do you need to place the urine bag to the genital area? So you need to remember, if the collecting bag is properly and securely placed, the procedure will not have to be repeated. So this ensures the leak-proof contact of the urine bag. So I already placed the collecting urine bag. So the first thing that I do, or that I did, is that I stretch the perineum taut during the application. So attach the bag perineum first, then proceed to synthesis. That is for female. I will pop up the picture of the baby or the infant while having the urine specimen collector or urine bag collector.
So after putting the collecting bag or the urine bag,
You need to apply the diaper in order if there is any possibly additional clear fluids. So you need to put back the diaper in order to prevent the leaking of liquids. Why do we need to get back or to put back the diaper? It is in order to give comfort for the infant or the young child as well. You need to elevate the head of the bed or place the child in an infant seat if appropriate in order to aid flow of urine by gravity. So you just need to elevate the head of the...
So you need to check the patient frequently from 30 to 45 minutes to see if the patient has voided. So when the patient has voided, remove the bag gently. So cleanse the area and reapply the diaper to the child. So if the child doesn't voided within 45 minutes, procedure must be repeated. So I will remove the diaper to see if the infant or the young child has been voided. Okay. So after I get it to the infant, I need to cut it here in a sterile scissors or the sterile pin. So I will put it in the container and then discard it. So after getting the urine of the infant, after putting the container, I will close it. And then after that, I need to clean the genital area again of the baby in order to prevent infection. So I will cleanse it again. I will dip it in a cleansing water. So from the top to the bottom. Okay. And then after that, I will close it again in order to get back the diaper. So why do we need to get the urine and to get back the diaper and clean the genital area before putting the diaper back? It is because the adhesive on the collecting bag may lead to be sticky. So careful removal of the bag will prevent skin injury and around the genitalia of the baby. So also avoid spilling urine of the urine bag during the removal. So you need to be careful enough when handling your patient. Just give the proper care that they needed. So after that, in that case, you gain the trust and elevate the anxiety of your client. So after doing the procedure, you need to remove your gloves and then discard it, and you need to wash your hands. And for the evaluation. So for the evaluation, of course, you need to document the procedure done, including all the assessment findings. So after removing your gloves and then you wash your hands as well, it is in order to reduce the transmission of microorganisms. So of course in the evaluation, you need to document the procedure done, including all the assessment findings. Because in order to have an accurate date for collaborative management and continuity of care. So I will put the blanket of the patient. So that's all for collecting the urine specimen from infant or a young child.